No doubt, homeopathy is also a great treatment and second largest treatment of the world. It's really amazing, especially in Pakistan, that on allopathy platform we are together because our one and only goal is to ease and cure the humanity. I will try to present a case of aplastic anemia cured with homeopathic medicines. Here is some description of aplastic anemia, a rare life-threatening blood disorder due to failure of the bone marrow to produce blood cells and significant decrease in erythrocytes, leukocytes and platelets caused cytopenia, and in aplastic anemia almost all the cells are decreased from their normal values. It can be severe and even fatal. Signs and symptoms: anemia, which is the first sign of the aplastic anemia, unexplained or easy bruises, unprovoked bleeding, fatigue, prone to infections, shortness of breath, rapid or irregular heart rate. It's because of low HB level. And remember, if HB level down to the 6, it's really risky to heart attack. Nosebleed and bleeding from gums, prolonged bleeding from cuts. Common causes: hereditary, septic conditions, viral infections, autoimmune diseases, idiopathic causes. हम जिस दुनिया में इस वक्त रह रहे हैं, मेरा ख्याल है इंसान अपनी रिसर्च में पीक पे है, लेकिन इस रिसर्च के बावजूद हम आज भी बहुत सारे डिजीज़ के कॉजेज फैक्टर को, काजेटिव फैक्टर को ढूंढने में नाकाम हैं, जिनको हम इडियोपैथिक जो है ना वो कह देते हैं. और मेरा ख्याल है कि यहाँ पे पावर ऑफ अल्लाह शो करती है कि इंसान को मज़ीद सर्च करना चाहिए. रेडिएशन थेरेपी, नो डाउट वी आर फेसिंग मैनी रेडिएशन फ्रॉम mobile poles, so the bone marrow suppression is occurring in our society. Excessive use of certain drugs, you know, in periphery, many doctors are using antibiotics and steroids in excessive form, and especially in children using 4th generation of antibiotics, so bone marrow suppression is appearing. And I have seen many cases which are facing bone marrow aspiration, and they are diagnosing AML, ALL, or just like aplastic anemia. Can develop at any age. And history of this case which I want to present here: she was admitted in Children's Hospital Multan for 1 month due to complaints of fever, progressive pallor and fatigue from 20 to 25 days, where she was given multiple transfusions and medicines. Here is a discharge slip from Multan. Umama Naeem, 9-year-old female, 27 kg weight, and date of admission is 16/10/18, and date of discharge 20/10/18. Here is the present complaints which was written down by the Children's Hospital Multan: fever from 1 month, progressive pallor, bruises, and on lower level no hepatosplenomegaly is there. Here is a CBC chart by the Children's Hospital Multan. On 16/10, when she was admitted in hospital, 16/10/18, HB was only 5 gram deciliter, TLC were only 0.87, and platelets were only 13,000. And after transfusion on 17/10/18, HB level was 5.8, TLC were 1.73, and platelets were only 36,000. On 18/10/18, after more transfusions, HB level was only raised on 7.9, and WBCs are 2.4, and platelets are 49,000 now. And here they diagnosed aplastic anemia, and here is a report by Children's Hospital where the myelopoiesis present depressed and erythropoiesis present and scattered. Lymphocytes present, abnormal cells are 0.1%, hypocellular bone marrow. On 19/10/18, she was diagnosed with aplastic anemia after bone marrow violation in Children's Hospital Multan, and at that time she was vitally stable after multiple transfusions in Children's Hospital Multan, and she was referred to CMH Rawalpindi for bone marrow transplant. In CMH, they evaluated bone marrow, and they also diagnosed severe aplastic anemia. And in Armed Forces Bone Marrow Transplant Center, her family bone marrow evaluation was decided and done, both parents and one of her sister, for bone marrow matching. Here is the admission and the report on 29th January, where the WBCs are 3.81 after transfusion, and hemoglobin was 8.4, platelets were only 8,000. And they have decided to evaluate the bone marrow evaluation for bone marrow matching of whole family. And here is one report of 12th March where HB shows 7.5 and TLC are 4.5 and platelets are only 23,000 even after multiple transfusions and a massive treatment, transamine, but the bleeding was there and HB became low. Here is a report of Umama patient which have required to be bone marrow transplantation, and the result and the remarks of the bone marrow matching report not compatible with HLA class 1 of donor Naeem Ahmed, which was her father, and Naeem Ahmed, her father report is remarked not compatible with HLA class 1 of recipient Umama. And here is a report of Fatima Zahra, her mother. Here is also remarks from the bone marrow transplant specialist, not compatible with HLA, human leukocytes antigen class 1 of recipient Umama. And here is a Nurul Huda, her elder sister, but here is also a remarks not compatible with HLA class 1 of the recipient Umama. And here is a final analysis and report from the Armed Forces Bone Marrow Transplant Center, aplastic anemia, severe aplastic anemia, and here is WBCR 4.4 and HB 6.7 and platelets are only 3,000 even multiple transfusions after there is decrease in all cells. And here you can send यहाँ पे आप देख सकते हैं no HLA match so far with no match with siblings and father. They have done 4 bone marrow matching tests, but all tests are not matching with this baby. And after exhausting all available resources, the case was declared. हम यहाँ पे बहुत सारी चीज़ें सोचते हैं, हम अपने किसी प्यारे के हवाले से, किसी पेशेंट के हवाले से या किसी के प्यारे के हवाले से जब हैसियत डॉक्टर होते हैं तो यकीनन इंसान की एक लिमिट है और उस लिमिट के बाद बहुत सारी चीज़ें हैं दुनिया में, क्योंकि हमारा दीन, हमारा इस्लाम क्योंकि जिसने हमें पैदा किया है वो कहता है कि लिकुल दा इन दवा हूँ। उसका ये फैसला है कि इंसान को जब इस ज़मीन पर उतारा गया तो उसके उतारने से पहले उसको जितनी भी बीमारियां लगनी हैं उन सब का इलाज भी दे दिया गया। Just need to search and find out that treatment and that drugs, that medicines. So they suggest to consult with alternative treatment. Here, start of treatment at the clinic of homeopathy and start of alternative treatment. She was presented in my clinic on 4/5/19. She was discharged and declared on 29th of April 2019. And here she comes on our clinic on 4/5/19 after 7 to 8 days with pale complexion and severe anemia. She was looking really very fearful because she had admitted in hospital from last few months, faced many problems, saw many deaths, given injection and pricked needle of different types of multiple transfusions and bone marrow sample, progressive fatigue, bruises on body and bloody stools with the low body weight, bleeding from gums continued. And here, our homeopathic methodology, we take a case as a drug picture. Our treatment was started from 4/5/19 to 21/12/19. After 1 month of the treatment, our weakness became much better with change of color from paler to normal. No bleeding from her stool and gums after 15 days of treatment. That is a picture. There is no bleeding from her gums. And after 4 months of treatment advised and fresh CBC report, that is a fresh CBC report on 2/9/19. Here WBCs are 6,300, RBCs are 3.3, hemoglobin level is 9.7, and platelets counts 33,000 with no transfusion from last 4 months almost. After 7 months and 16 days of treatment, she was quite normal, no bleeding from last 6 months. Her color was pinkish from normal, just like normal kids. We stopped our treatment on 21/12/19 after almost 7 months after observing our whole picture. And he advised again a CBC report on 27/10/21. Here is a report. WBCs are showing 9900, RBCs are 4.6, hemoglobin level is 12.1, and platelets count 1.86. Almost 3 years has been gone, and still normal. He have started her menarche and with normal periods and normal bleeding. Thank you very much for your cooperation.